shift in public expenditure in the next decade will be in healthcare spending. It will grow significantly as our population ages and as medical technology improves. Now let me show you a chart that shows Singapore's and other countries' public health expenditure as a percentage of GDP against the share of the total population that is over 65 years old. So on the x-axis is a percentage of total population is more than 65 years old, and on the vertical axis is a public health expenditure as a percentage of GDP. Now, the triangle shows the year 2000 and the circle the year 2015. So in other words, a period of 15 years. When you look at the green line, South Korea, the purple line, USA, New Zealand, Germany, the blue line, and Japan, the yellow line, you can see how they have all gone up sharply as population ages and as technology improves. And as a percentage of GDP, the USA is at the highest at almost 14%. Germany at about 9%, and Japan at also about 8 or 9. In Singapore, it has also risen. Now, the dotted line represents the future, the projections by the OECD. The OECD have made similar projections for others, so we did a similar projection to look at what would Singapore's numbers be if we use the MOH's projection, and that is the bottom, the lower line, right, the lower dotted line. And then the upper dotted line is if we were to use the OECD's methodology, OECD's trends. So as the share of seniors increases over time, public health expenditure has simply increased. And as I said, medical technologies will continue to improve. And this trend has been played out in Singapore and all the other countries shown in this chart. Over the past 2 decades, our healthcare expenditure has grown rapidly. In 2000, government spending on healthcare was about 0.7% of GDP. By 2015, it had tripled to about 2.1% of our GDP. This additional spending has gone towards significant improvements in healthcare accessibility and affordability. We have introduced new schemes such as MediShield Life and expanded CHARS to cover all Singaporeans for many chronic conditions. Since 2010, we have opened or expanded 8 hospitals. We have built 2 new polyclinics and redeveloped 3 existing ones. Now, don't get me wrong, the spending is not just on the infrastructure. For every hospital that you build, the CAPEX that we put in, the operating expenditure, the OPEX, is even more. So it just tells you the trend that we are heading towards. And healthcare spending is not just about treating the sick. It is also about giving our seniors a better quality of life. The number of cataract operations per year on seniors increased from around 10,000 in 2000 to almost 30,000 last year. Such procedures were less common in the past because people did not live as long as they do today to need them. And because of advances in medical sciences, previously incurable diseases like cancer can be better managed, and patients can continue to live for more years with good quality of life. The number of citizens aged 80 and above has almost doubled, from 63,000 in 2009 to 112,000 in 2019, and will increase further. Going forward, healthcare spending will continue to grow significantly. So while it is a very good thing that our people are living longer, we must be prepared that we will have to spend more on healthcare. So we expect public healthcare spending to grow by around 1 percentage point of GDP over the 15 years from 2015 to 2030. And this is, in fact, as I mentioned to you earlier, less than the average increases projected in the OECD countries, partly because of our efforts to keep healthcare costs sustainable and because Singaporeans have increasingly adopted healthier lifestyles. But our healthcare spending may rise by more than this 1 percentage point if medical costs rise throughout the world, and we do not bring problems like obesity and diabetes under control. As Mr. Lim Biao Chuan said, Singaporeans must understand the increased spending on healthcare must come from somewhere. Some have wondered if we can spend less or spend more efficiently. And indeed, it's not just about how much we spend, but how well we spend. Today, we achieve good outcomes at a lower cost than many other countries. In health, we have the highest life expectancy in the world, almost 85 years, but still spend less of our GDP compared to other countries, as you can see in this chart. Our life expectancy compared against public health expenditure as a percentage of GDP of various countries. In fact, former World Bank President Jim Yong Kim said that it was stunning that Singapore had achieved its current outcomes despite relatively low spending. So thank you to our people and our healthcare workers for taking care of their own health and for doing such a good job. Similarly, for education, our 15-year-olds do well in international indices of educational attainment, like the PISA test, despite Singapore spending less than other countries. We are able to achieve this only because of a whole of society efforts. On the government's part, we have carefully designed our education and healthcare systems to deliver good services in a cost-effective manner. We have dedicated and passionate educators who believe in developing every child to their fullest potential. We have committed healthcare professionals who believe in delivering the best care to all Singaporeans. There is strong support for Singaporean families from community groups and social service agencies. And Singaporeans themselves play an important role in taking responsibility for their own learning and health. And we are always looking for ways to improve outcomes in a cost-effective manner. Minister Lawrence Wong will elaborate on some of these efforts during MOS COS. But efficiency savings will never be enough to fully offset the growth in healthcare spending as the population ages and medical sciences improve. Efficiency savings can only mitigate it. To believe otherwise is wishful thinking. Ms. Fumiha shared that some Singaporeans have questioned the need to raise revenues to meet the expenditures I mentioned, pointing at surpluses seen in this term of government. But our healthcare spending needs are not one-off needs. They are recurrent needs, meaning that these needs will be there year after year. In fact, growing year after year. So we need to fund them using recurrent revenues, not one-off surpluses seen in this term of government, which arose from unexpected rally in global financial markets and the unexpected buoyancy in the property market. We cannot hope to keep on being so pleasantly surprised. Things can very quickly swing in the opposite direction, as we have seen from the COVID-19 outbreak. The outbreak reminds us why we need to plan ahead to raise revenues. We must ensure that we have enough resources to meet our people's needs, driven by structural factors. Otherwise, we'll find ourselves short and have to raise taxes or cut spending in difficult times, precisely when businesses and people need a boost. Planning ahead entails being honest with ourselves and with citizens, and having the discipline to raise revenues in a timely manner. Yet, among those who agree in principle on the need to raise taxes, some have asked, why GST? As I've explained before, a broad-based tax like GST is an appropriate and responsible way to pay for major societal needs like healthcare spending. Such spending benefits all Singaporeans, and so it is fair for everyone to bear some part of the cost. This is about all of us taking shared responsibility to pay for our needs and our society's needs, and sharing in the effort to provide for them. It is at the same time a Singapore-style GST that comes with offsets to ensure that those with lower incomes pay much less than those who are well off. In fact, at the individual level, many Singaporeans are willing to chip in to meet these needs. In my conversation with my constituents, I've asked if they will be willing to contribute just 20 cents more out of $10 that they spend a day, if this will help to ensure that their healthcare needs and those of their parents were adequately taken care of. Many were willing to accept this small cost for the peace of mind. The compact does not change when we project it at the national, project it to the national level. The compact does not change when we project it to the national level. This is ultimately about us collectively chipping in to look after the healthcare needs of our families. Each generation must pay for its own spending. Ms. Fumiha and some others have asked if we should raise income and wealth taxes instead of GST. In fact, we have been doing so in recent years. In 2010, we made our property tax regime progressive by introducing higher tax rates on owner-occupied residential properties with higher annual values. We enhanced the progressivity of our property tax system in 2013 with higher property tax value for homes and non-owner occupied residential properties. In 2015, we raised the top marginal personal income tax rate from 20 to 22%. The following year, we introduced a cap on the personal income tax relief to make our regime more progressive. In 2018, we raised the buyer's stamp duty for residential properties in excess of $1 million in value. In all these times, when we were raising income and wealth taxes to support the country's growing expenditure, the GST rate remained at 7%. The last time we raised it was in 2007, more than 10 years ago. But we should bear in mind that there is a limit to raising income taxes. If we keep raising income taxes, you will eventually hurt middle-class Singaporeans who presently pay very light income taxes. You also risk losing our ability to attract talent and keep our own talents. As Ms. Ting Pei Ling said, talents begets talents. There is a virtuous cycle to this. It is important to have a critical mass of talent in Singapore to create jobs and economic vibrancy, which will benefit Singaporeans. That said, as important as raising the GST is, it is only one way to meet our revenue needs. An increase of 2 percentage points in the GST rate will provide us with additional revenue of almost 0.7% of GDP per year. But the increase in annual government healthcare spending alone that I mentioned already exceeds the amount of additional revenue. So we will continue to adjust our income and wealth taxes to raise revenue in a progressive and fair manner. We should also keep international tax developments in mind as we review these taxes. Both personal income tax as well as corporate income tax. As Mr. Cedric Foo and Mr. Henry Kwek noted, there are ongoing international discussions to revise tax rules under the base erosion and profit shifting project. Hub economies with small markets like Singapore stand to lose corporate income tax revenue if new rules are adopted. This is because the new rules allocate taxes to where the customers are, rather than where the underlying economic activity is conducted. Businesses are highly mobile in today's global economy. Companies, especially multinationals, have the flexibility to relocate their businesses out of Singapore to elsewhere. Singaporeans may lose their job. So Mr. Singh asked me earlier about the status of BEPS. Well, in fact, I'm glad that the Ministry of Finance officials have been very involved in these international discussions. Some of these discussions are confidential in nature. Some of it have been made public. But I assure Mr. Singh that hub economies will have to bear some negative in this exercise for the reasons I mentioned. Where you tax the activity. Is it where the consumers are or where the underlying economic activities are? That change in principle alone, you can work out what the effects will be for us as a hub economy. So we therefore need to strike a fine balance between our corporate income tax rate and economic competitiveness. Ultimately, how much we spend depends on how much we collectively have to pay in the form of taxes.